Hello, I'm Dr. Maurie Markman from City of Hope, and I'd like to discuss very interesting and I will suggest a very controversial topic. Certainly, when we get to the end of this brief discussion, that will become evident. So the paper I'm discussing is entitled Germline Pathogenic Variants Identified in Patients with Genitourinary Malignancies Undergoing Universal Testing, a multi-site, single-institution prospective study published in the Journal of Urology. Of course, it has been well recognized for over a decade that patients with ovarian cancer need to have germline testing, independent of the question if they have a family history of that particular cancer, because we identified particular mutations, BRCA mutations, BRCA1 and BRCA2, that may not be evident in the family, but by history, but are very relevant potentially for cascade testing of their family members later. And also, of course, in that setting, there are therapeutic implications as the use of PARP inhibitors. Increasingly, the discussion is about more universal testing for patients with breast cancer because of the incidence of BRCA and other mutations that are both relevant for treatment, but also for the question of genetic counseling for other members of the family. But what about other tumor types? What about GU cancers, as identified here? Should one, say, take patients with all different kinds of GU tumors, prostate cancer, bladder cancer, kidney cancer specifically, and say there's a role for universal germline testing when a patient has been identified as having one of these cancers? To address this question, the group at the Mayo Clinic undertook comprehensive germline testing, examining for pathogenic germline variants at their several sites from April 2018 to March 2020. This was a greater than 80 gene panel that was offered to patients. Today, that testing may be really quite different, but at that point, it was greater than 80 genes that were tested for potential abnormality. There were a total of 601 patients who enrolled with GU cancers, again, across the sites and with GU cancers regardless of a family history. 358 prostate cancer patients, 106 bladder cancer patients, and 137 kidney cancer patients. And surprisingly, the majority of these patients, 86%, were male. But here is the important bottom line. Pathogenic germline variants, most with risk of high penetrance, were identified in 82 individuals, or 14% of the population. First, they were seen almost the same percentage in kidney, bladder, and prostate cancer, and that 14% is not that far off. In fact, quite similar to the statement about ovarian cancer in terms of the overall population, 14% of the GU cancer patients. Importantly, at this time, based on these data, fully 67%, or 2 out of 3 patients' abnormalities, were potentially actionable. Now, actionable could mean a variety of things. It could obviously mean there may be a therapy involved. It could mean that, we need to talk to members of the family. But they were not, that's interesting, there's nothing we can do with it. 2 out of 3, it could actually do something actionable. And importantly, of those 82 patients, 35% had at least one relative undergo cascade testing to examine for that variant. Bottom line here is 1 out of 8 patients, actually more than 1 out of 8 patients, in this unselected group of patients with genitourinary cancers had a variant finding that was potentially pathogenic at the germline level. And this would argue for, although there's going to be controversy, we need more data, universal testing, certainly of GU tumors, and one might ask for other tumor types. More data to confirm that. This is obviously an extensive new universal recommendation, costs associated with it, but this paper certainly raises that question that needs to be further examined. And I thank you for your attention.